I call the meeting to order. I'm Don Boyd. I'm the second string. Nancy Wexstein had a death in the family and can't be here today, so I'm filling in. And we don't have a quorum, at least now, so we won't be voting on minutes or doing anything else that requires voting. And with that, I turn it over to Ronnie for the director's report.
Okay, two people to welcome. Although I'm looking around.
She was out with a bad back.
Oh dear. Okay, so let me first talk about the woman who's not here, who's Erica Vladimir, a budget and policy analyst for the education team. Prior to joining IBO recently, she was the education analyst and counsel for the Independent Democratic Conference in Albany. Those people. Or as she put it, I've gone from someplace that was unpopular to someplace that's unpopular. We're already tapping into her knowledge about Albany and the New York State budget process. She's got a law degree from Touro Law Center and a BA from UConn, and she's working on education and budget issues, but particularly focusing on state and federal aid. And this is a skill set we hadn't hired before. Our other new hire is Danila Penkov, who is here, who's an economist who'll be covering sales, utility, and hotel taxes. Danila just finished up his PhD from the University of Virginia. And what he did was an in-depth study of sales taxes. And in particular, he looked at how you can look at changes in sales tax policy and tease out their implications for consumption and for tax collections. So one of the cases he used was the many different clothing sales tax changes that happened in New York State and New York City some years ago, and look at the lessons that could be learned from those. And it was great to have him with us because we have somebody who's actually come in with research experience in an area where we really haven't had depth before. He did his PhD at UVA, and he did his master's at the New Economics School, which is actually in Moscow. When we all read it, we thought it was here. In fact, in Moscow. And the other coming and going I was going to mention is Frank's. We're having Frank's, there's Frank, okay, retirement party on Thursday night. For those of you who don't know Frank, Frank was one of IBO's first employees, which was, by the way, exactly 20 years ago now. He came into IBO with experience at Council Finance and OMB, which made him a terrific hire for us. Originally, he was hired to be the number 2 person on the spending side of the office. And then, after a relatively short period of time, when it became clear that the number 1 spending person wasn't exactly working out, and at the same time dividing the office into 2 silos of spending and taxes that basically didn't interact in any way, didn't make sense. Frank was promoted to deputy director, where he's been ever since as our chief accountant and budget guru in chief. He's the person who follows the money for us. He tells us where it came from and how it got there. He trains everybody who comes into IBO. Everybody who gets budget training spends a lot of time with Frank. They then come back and ask Frank all of their questions all of the time. And when they're not doing that, they're asking Frank, they're just hanging out in Frank's office anyway.
Not a lot. 5 minutes.
Yeah. My office is next door, and I can see the steady stream of people in and out as I just sit there alone in the corner. It's hard. We're not thinking about replacements. We need to hire somebody as close to Frank as we can get. And if you have any thoughts on who might help us with that, that would be great. We've just started advertising for the position. We've also started advertising for a health economist. You'll be meeting our health economist very shortly. She's done wonderful work for us, but she is going on to HRA to get some experience in the operations side of life. So if you've got thoughts on health economists, that would be great too. Okay, I just wanted to talk about one upcoming publication rather than give you a laundry list. And the reason to talk about it is it's just really different from what we usually do. It's a study on students in temporary housing. It's by Liza Pappas. You've heard her in the past talk more about her quantitative work. Hey, Ernie. Students in temporary housing are primarily in doubled-up housing, families living with relatives or friends, or in shelters. We've concentrated on the shelter part of the equation. And what makes this different from IBO's other research is that it's the first study we've ever done that's based on qualitative data, which for me has been an education. It's included nearly 100 unique interviews across 12 New York City public schools, talking to parents and teachers and staff, also talking to staff at the Department of Education's Students in Temporary Housing program. There were 8 focus groups, 2 groups of principals, and I guess we have a lot to thank Ernie for in terms of getting into the schools and getting the principals, and 6 groups of parents with children in public schools living in the shelters. It's been interesting to watch the process. There are whole sets of metrics that are built to determine what themes are consistent throughout the interviews and the focus groups. And then there are decision rules that let you determine how many times does a particular issue have to be, or related fact have to be mentioned before we can feel confident enough to put it in and include it as a finding. So all of that is in the process of going through its final edits and should be out in about a month. A couple of other publications that are on tap are some more work by Erin on health and hospitals and on the mayor's mental health program. Paul Lopato's got some upcoming work on the Early Learn program, enrollment and capacity, and Joy Deep Roy on high school choice. So that's stuff to look forward to over the next couple of months. The other thing I just wanted to bring up was we're planning some major changes to our education indicators volumes. Last year we put out 2 of them, one on traditional public schools, one on charters. We realized it didn't make a whole lot of sense to just wait until compile all of the information we had and then just put it out at one time, either for the traditional schools or for the charter schools. So we're moving to make it all more of a web-based presence. We've divided it into, we've combined the charters and the traditional schools, parsed it into 3 main categories, one demographics, one resources, one on budget, and we'll be releasing that information as it's completed. So instead of letting some of the information age while we get everything else together, you'll be able to go onto the web and say, aha, at this moment I've got new data for this and that, but not for the next thing. I think that's, more and more web-based content of that sort just makes more sense for us. And I think it will serve people better. We're also changing the format of what we're putting out. We relied heavily on you do the tables yourself. The tables are all there, take what you want. We'll be doing more discussion of what the tables show, although we'll be summarizing it more in graphic form and then linking to the appropriate tables. So we'll be leading readers along a little bit more than we have been, and hopefully making it easier and perhaps more enjoyable to use. So, that whole trend, we're also, looking at ways to move the options volume to be more of a web-based publication as well. But, those are the big things that have been going on. So?
Okay. So, we're still welcome. Nancy couldn't be here today. So we should begin with staff presentation.
We should begin.
George, and
Yeah.
we're just waiting an adopted budget update.
Snuck it in.
Okay, good morning. So as Ronnie indicated, or Don indicated, I'm going to be talking a little bit about how the adopted budget was put together for fiscal 2017. I'm going to be using terms like typical or not typical, which, given the audience here, makes me a little nervous because there are actually people here who have been in the room when these kinds of decisions are made, and they have much more experience than I do in terms of knowing what's truly typical or not, but we'll see. So the key points I'm going to be talking about is that this year the adoption process was relatively stress-free. Some might even call it boring. I think although it was an easy budget to adopt by most standards, there were some differences this year, I think, at least at the margin from what's typically done. I think a lot of it was striking that a lot of the resources that paid for the council's initiatives, the ideas the council wanted, the priorities the council made of getting into the budget at adoption, came from savings that were recognized elsewhere in the budget, rather than from using some of the what looks to be like a small amount of additional revenue that's there and that's available in the revenue forecasts. The big changes that the council succeeded in getting put in the budget included additional funding for libraries, for youth employment, and for after-school programs. There was a lot of use of two terms in the budget discussion this year. One was baselining, and one was reserves or budget reserves. And I just we'll talk a little bit about some of those. So the budget adoption process in New York really begins with in January with the preliminary budget. And the mayor releases his preliminary budget, the council holds hearings, and at the end of that, the council identifies its priorities for where things will go, what it will look to add to the budget that the mayor may not, has not included at that point. So the council submitted its response to the preliminary budget. The mayor came back with his executive budget in April. It addressed some, but not all, of the things that the council had identified as priorities. And so after the executive budget, these were some of the priorities that the council had identified that had not been addressed by the mayor. One was to expand the summer youth employment program. This is a perennial debate or perennial issue in the city. Partly because the funding includes a lot of state funding, so there's some volatility in there, which makes it a little more difficult to set the budget. But it's something that comes up in many years. The city also last year had, building off of the summer youth employment program, had developed a model for year-round youth employment programs. It was set up as a pilot, and the council was very encouraged by the response to the pilot and wanted to see that built up. Restoring 6-day service at the public libraries, that goes up and down in terms of the number of days over the years. In recent years, it's been below 6 days in most of the systems. There was also an emphasis on expanding after-school programs, both at the elementary school level and particularly in the middle school area. The mayor, when he expanded universal pre-K 3 years ago, he also included middle school after-school programming. That was another part of that program. What had been left unaddressed in the mayor's program was what to do during the summer. And so the council a year ago fought hard to get a summertime component of that program. It was put in on a one-year basis a year ago, and the mayor had not proposed anything to extend it forward. So that was another issue that the council was making a priority out of. And then also, and this I think this is one of the areas where it's a little different. The council put a lot of emphasis on the city asking the mayor to identify additional budgetary reserves and to identify them and put them into the budget. So we'll talk a little bit more about that. Now, when, again, typically, the way the city tends to, the way the budget negotiating process tends to come to resolution is you can identify some savings, but a lot of, in many years, it's really about recognizing additional revenue that's out there. The mayor will have a revenue forecast that's usually lower than both council and some of the other agencies such as IBO. And by recognizing that revenue, that gives you the resources to address some of the remaining priorities that the council has. This year, as is fairly typical, there were some differences. They're not huge, but you know, there were differences from where OMB was at exec. For 2017, Council Finance was up $388 million relative to OMB. IBO were the traditional optimists. We were about $700 million above OMB.
Realists.
So, a lot of numbers on here. Here's how they actually did it this year. And let me start out by just explaining what the numbers on what the different sections of these of the chart are. At the top, we have changes or sources, and these are sources of sources that can be used to add to the budget. If you've got a positive number, this means that's additional resources that are available. Negative numbers, which are in parentheses, are things that use up resources. I'd also point out just that the total numbers here we're talking about are pretty small. I mean, the New York City budget is about $59 billion on city funds and about $82 billion on all funds. So we're talking about $600 million here. Not a big amount, not really big numbers in play for the whole, the budget process, the budget adoption process. I think it's notable that of the resources that were identified, only 172 million came from revenues in 2016, and there's actually an identification of loss in revenue in 2017 for 94 million. So your two-year total is only 78 million. It's a pretty small number. And of that, only 41 million comes from taxes. The rest came from miscellaneous revenues, which are an assortment of fees, fines, pretty small things. So they didn't really go to the tax revenue forecast, the tax revenues as a source that would create resources that could be used to pay for adding programs to the budget. The other thing they did was add to the citywide savings program. And again, the council had made an issue out of wanting to see additional savings added to the mayor's program. The mayor had put together a program that was, where was it? It was about $2.8 billion over 2 years in his executive budget. The council pushed hard, and they identified another $315 million in savings for 16 and $135 million in 17. So that's a 2-year total of additional resources of $450 million. As was true with the mayor's program, a lot of that is actually not about actually changing programs. For example, 91 million of that came from debt service savings, additional debt service savings that were recognized. The other pieces on here are sort of the more traditional budgetary housekeeping, expense changes and adjustments that go up and down. They increased their estimate of what the value of the final write-off of prior year payables and receivables will be. Drew down the general reserve 30 million. That's not, that leaves 20 million in the general reserve, but of course we only have about another month to go on the, or I guess it has to carry through the close. But it's not, that's a typical number to wind up at this point. And it still leaves $1 billion in the 2017 budget for the general works. So then we get to uses. This is what they did with those resources. So the total is $602 million of new resources that are identified. And again, here, a negative number means you're using up your resources. Positive number means that works in the other direction. So the first thing they did was add to the prepayments that the city makes. The city, as many of you know, is not allowed to have a rainy day fund. So if we have a surplus in the current year, you can't go and park that money in an account and identify that as money that's being saved. So we deal with that when we have surpluses by finding ways of prepaying some expenses that would normally be due in the next year. You pay them this year, so you're using up your surplus in the current year. That also has the effect of reducing your projected expenditures in the out year. And they increased two of the prepayments that had been identified previously in the budget. One is they added $237 million of debt service prepayments, and this was this part was notable. They also looked to HHC, and we'll hear more from Aaron about HHC's fiscal situation. They identified $400 million that they were expecting to pay to HHC over 2017. They identified that and are paying it early in 2016. That may be because they're really worried about the cash position of HHC, but it may also be there are constraints on how much they can use debt service as a prepayment tool, and so they have to look for other places. And one of the places that they looked to was HHC. So the city, under the state constitution, there's a limit on how much you can raise through the property tax for operations as opposed to debt service. And if you prepay a lot of debt service, it makes it harder to meet that test on the operating limit. They're very, very close to the operating limit this year, surprisingly close. So I think that may have been one of the reasons they went to prepaying HHC. Of course, it's hard to deny that HHC could use some cash at the moment too. So. But seemingly HHC wasn't really expecting this. It came at the last minute. So. Another use of the newly identified resources was to put more money into the Retiree Health Benefit Trust Fund, and I'll talk a little bit more about what the trust fund is. The mayor had already had an increase of $250 million of his own in the earlier in the budget process. The council, again, consistent with their push they wanted more savings and they were looking to build up fiscal reserves, pushed, this is one of the ways that the city is building up at least what it counts as a reserve. So they put another $250 million in there. That brings the value of the benefit trust up to $3.9 billion. Although not all of that, I would argue, is properly viewed as a reserve. So that finally left the council initiatives. These were the things that, having done all of this, the council, the value of the priorities the council was able to get into the budget amounted to spending an additional $352 million. And so you wind up exactly offsetting your 602, which you should, so that you're in balance across the 2 years. So just very quickly, some of these initiatives that were put into the budget. The first there are three big items that the administration agreed to baseline in the city budget going forward. So that means they put money as an appropriation for 2017, and then there's money in the financial plan for the subsequent years for these three items. One is the summer youth employment, which I mentioned earlier, that the council wanted to see, a permanent solution to the budgeting for that program. There's $38 million has been added to the baseline, and that will provide $38 million of city funds, and that will provide for 60,000 jobs on an ongoing basis. This was somewhat new this year. They put $22 million, again, baselined into the district attorney's offices. That had been something that the council really took as, in their hearings, there was a lot made about the budgetary challenges for the district attorney's offices, and the council responded by making that one of their priorities. And finally, they, again, baselined, meaning they put it in this year, and then it's at least in the financial plan for the subsequent years, $21 million, and this will allow the library systems to bring 6-day service back into place across all 3 public library systems. Then there were a number of additions that the council sought and got, but only, these were not baseline, so there's only an appropriation for 2017. It's 20 million, and I should also say that in these numbers here, this includes money that the mayor also added. So these totals, some of these, there's money beyond that $352 million that the council added. These numbers include some money that came from the mayor. So there's $20 million for cultural institutions, mostly to smaller organizations, not the big, the cultural institutions groups, which are the big organizations operating in city-owned buildings. Again, the council had made an issue about the middle school, after-school programs. So there's $17 million to cover 26,000 slots, but just as last year, they settled on a 1-year extension of the program, they're doing that again. So this carries it for 2017, but it leaves open the question of what happens in 2018.
George, when they're saying slots, they're meaning locations or spots? What are they talking about?
A slot is basically for one. It's a person.
An individual.
You're right. I mean, there's an assumption that not every kid attends for 5 days a week. It's like, but it's.
So 26,000 kids.
It's capacity for 26,000 kids at any one day.
Okay, so is that the same thing with the summer jobs and with the
Yes.
baseline for 60?
Yep.
So every year there's a guarantee of, at this point now, 60,000 summer jobs.
Right. There's also a smaller increment over what the mayor had proposed for elementary school after-school programs. It's a total of 6,600 jobs with the new money, but again, only 1 year. And finally, that year-round youth employment program, which I think is going to be something that's going to continue to get a lot of attention, but at the moment, the agreement only dealt with it for 1 year.
I'm sorry, I'm late, Diana. I just wanted to make sure that Ernie understands the guarantee is not equal to baseline. Baseline today is guaranteed, but that could be cut at any moment.
You must have been looking ahead.
I'd hate for him to come next year and say, George, you said this was guaranteed.
Okay, so, thank you for the segue. So I did want to just talk about, because as I said before, there are 2 terms that were were heard commonly this year. One was baselining, the other was reserves. So baselining. Appropriations are only for the current year. In New York City's budget process lacks the concept of sort of an approved program. If you think about what happens in many programs in Washington, you have authorization language that creates a program, and then you have an annual appropriation process that actually funds it. We don't really have anything like that. And so what we do instead is if a program gets identified as something that people support and becomes ongoing in the budget process, the way to recognize that it will continue is you allocate fundings in the out years of your financial plan. But that's not an appropriation. And it's not binding, as long as someone's willing to pay the political price of cutting it, or, you know, or at least being told you're cutting it. Because arguably, if it's not, you know, there are different ways of spinning that presentation. A good example of what happens with this is library funding. If you look back in the 2008 budget, which was adopted in the summer of 2007, there was $42 million baselined to provide for 6-day library service. And that was considered a great achievement, and there were congratulations all around. But then, beginning in January of 2008, the recession, it was actually, so the city began taking actions even before the recession really hit the city revenues. But there's a series of cuts to the city budget, including to library funding. And so gradually, that commitment to 6-day funding whittled away, and by this point, by this year, it was down to 5 days and 4 in some locations. So this year, once again, the council has made a priority out of reestablishing 6-day service in the city's budgetary baseline, the city's budget baseline. And you know, we'll see how long this commitment lasts. But as Diana indicated, it's, you know, the appropriation is only for this year.
So, George, do you have a sense, I mean, obviously, some things like Medicaid or debt service, you are, you know, practically committed to. Do you have a sense, like, what share of the budget you're kind of committed to?
You know, I think people go around and around on trying to estimate that, and depends on exactly what you're going to count. You know, you know, by the time you add up all of your police and fire allocation, you know, your deployment of, well, I guess when you start with the size of the force and then the deployment of it, I mean, those are pretty sticky and pretty hard to change. And if you take those off the table, that's a big part of the city budget. So I think you're probably down to, I'm hesitant to give a percentage, but I think it's got to be, it's certainly less than half, and probably, I don't know, a quarter, something in that range. That would be my guess, but I think a lot of people have spent a lot of time trying to figure that out.
Doesn't it also depend just on your time horizon? I mean, at any given point, you know, we may have labor contracts at any given point in time, but sooner or later those contracts are up. Theoretically, those terms can change. So things that you think of as, you know, unchangeable, you know, at the moment, over a several-year course of time, could be very different.
And a lot of these a lot of the programs where you get this, they get highlighted in the budget adoption process are not delivered by city employees. A lot of this is contracts with not-for-profits and community-based organizations, which does make it easier to cut them off than to actually, you know, lay off city employees. So it's concentrated in particular sectors of the budget.
George,
Yeah.
isn't there another aspect to the council's desire to have baseline? In addition to this presumption or of the current intention to continue funding, if something that you're routinely adding at adoption as part of the $637 million price of adoption, everything you can take off that list and baseline frees up additional dollars for new goodies to fill the spot in the price of adoption. So there's a second, more real politic reason for sort of baselining, because you can do more.
Although I'd argue, I mean, there's also politically value to the city council to be seen as rescuing these programs every year. So, you know, that works the other way. And finally, just want to say a little bit about, because we heard the term reserves a lot in this process. And the council, in their budget documentation at adoption, identifies what they use the figure $8.8 billion that they think, that they count as a reserve in the current budget. I won't go through all, or I'm happy to go through some of the components of that, but the single biggest one is the Retiree Health Benefits Trust Fund at $3.9 billion. And it's important to remember, first of all, that why we have a Retiree Health Benefits Trust Fund. It's created, it was created in response to a change in the rules put out by the GASB, the Government Accounting Standards Board. I think Don could help us on this, which requires governments now not to fund their the liability for the benefits that they're promising for the out years. And these benefits are largely health insurance benefits. The term other OPEB, which are other post-employment benefits, it's largely health insurance that governments have committed to their employees after retirement. GASB says you don't have to fund it, but you at least have to identify it. And so we now have in our financial statements, and we've had for 10 years or so, an estimate of what the city's liability actually is there. Right now, it's about 57 or 58 billion in at least in last year's CAFR. So in the Bloomberg administration, they were they created this trust fund and began putting money in it to at least begin to build up some cash that would be available to satisfy those liabilities. It's not a rainy day fund, and nothing in the official documents about the trust fund identify it as a rainy day fund. However, the city has been able to find ways to use it as a rainy day fund. I would note that if it were ever officially identified as a rainy day fund, it would violate the GAAP accounting rules, which are in the city charter. But it has functioned as a reserve. I think it's notable that the city documents increasingly refer to it as one. I mean, the council's statement it's very clear. This is part of the city's reserves. At some point, I don't know if there are GAAP police out there, but they could. Or Frank may become one. Someone could come and raise questions about how we do that. The other key point about the trust fund is, again, in the council documents, they identify the full value, what's currently appropriated what's currently accumulated in the trust fund at about 3.9 billion. But if you were going to use that for budget relief, you can only take out of it this year, in whatever current year you're taking out, what the current year's appropriation for retirees' benefits are. You can't take out more than that. And at the moment, this year, that would, or for 2017, that would be about 2.7 billion. So that's a significant difference from the full 3.9. And that's something I think gets lost in the way these numbers are thrown around.
If you had a, I'm sorry.
So, I want to make sure I understand this. So the city declares how much its expected liability is, but they don't fund it fully.
And no one fund. If anything, we're the outlier in beginning to fund it.
So is the estimate of the liability even actuarially accurate?
Yes. Well, I don't know if it's actuarially accurate. It's actuarially estimated. I mean, it's estimated using actuarial terms.
It's not made up.
Yeah.
I understand that it's not made up of whole cloth,
Yeah.
but I do remember reading that many governments use questionable assumptions in estimating actuarially accurately their their liability. So I'm just curious whether New York follows that trend or is an
Usually
outlier.
referring to the way pensions are funded, not OPEB liability.
OPEB estimates tend to be more conservative than pension estimates, for what
Okay.
that's worth. you know.
And actually, when this all started, about 9, 10 years ago, the value that was being used, the unfunded liability value, was about $90 billion. And the actuary, I guess, a couple of years ago, changed the methodology
Right.
and brought it down to 70 and then back down to 50. So it's a pretty good number.
Where's it stand at now?
I believe it's in the upper 50s.
It's come down for several years, and one of the reasons why it's come down recently is, you have built in an assumption of future growth.
Right.
So if your current healthcare costs grow less than they have historically, then that flows through your model all the way out for decades and brings down your liability. So as the city in the recent years has experienced slower healthcare cost growth, that has reduced the OPEB liability in the future.
But it
But the
also-
same methodology is used for OPEB as the pension, so if you have concern about the OPEB calculation, you have concern about the pension
Oh, I'm
calculation.
sure I do, yes.
And that's very dear to my heart, so
But
just saying.
George, doesn't the new tier created last contribute to also that declining?
Well, I don't think in the
Doesn't change the
OPEB,
health.
it shouldn't change the health, it would change it does change the pensions, and you can begin to see that already.
There's
But the
discussion.
health pensions are different than, are not calculated as part of what would have to be supposed to be.
This is just the health, this is just the health insurance benefit.
But the healthcare benefit stays the same no matter what tier you're in?
Correct.
Yep.
There's some talk about some change. Currently. There's lots of conversation, that's why I want to hear the HHC presentation, a lot of conversation about future future city employee health benefits that's on the table now, so Mark is smiling, but.
Maybe to make sure we get to HHC, turn it over to Ray, or?
Sounds good. Okay. Ray's going to be discussing something that we thought we were going to discuss last time. Some work on test scores that, for me, were really surprising.
This presentation is based on a report that we actually published in February. It's available on our website, so if I confuse you, you can look at the full report afterwards, okay? There were a couple motivations for this brief study. It started, in my mind, back in the fall. And at the time, there was a very loud discussion in the city being driven by a number of advocacy groups that essentially boiled down to this. New York City public schools, bad. Charter schools, good. And all we need to do is have more charter schools. Now, I understand advocacy. I was an advocate for many years before I came to IBO. But, I think sometimes you have to be a little more nuanced than that. I also understand charter schools. I helped start a couple charter schools before I came to IBO. But it struck me at the time that argument was way too simplistic. Okay? And it also bothered me that the press was being rather uncritical. In the last couple days, the last 4 or 5 days, we see this thing is still there, right? We just went through a battle about mayoral control that didn't get renewed until the last minute, well past the deadline, actually, that they set for themselves. That was largely based on the notion that there is something uniquely bad about public schools in New York City. We could recite a couple of things that have happened in the legislature over the last 18 months to 2 years that are specifically directed at New York City. The rules for charter schools are different for New York City than the rest of the state. The city provides rental assistance. That's not true in the rest of the state. There are other ways in which the city has been targeted for this. And just this morning, if you see the early reports in Politico and elsewhere, the mayor is trying to reposition his position vis-a-vis charter schools. So this is an issue that's still with us. So I wanted to shed some light on what I thought was a more nuanced story. I'm not going to tell you now that there are no problems in the New York City schools. Okay, there are reasons to be concerned, and we need to maintain a sense of urgency about improving the schools. but the statistics that people cite, largely proficiency rates in the 30%, are there for a reason, you know? And another thing that offended me about the political debate, particularly last fall, was the same folks who were touting the 30-something% proficiency rate were arguing that the problem was the administration needed to go back to do the same things that the previous administration was doing. But the 30% happened in the previous administration, right? That was sort of being left out of the argument. This first panel the first two panels shows New York State, New York State proficiency rates on the New York State test. And we're comparing, there are two tests on these charts. First of all, the right side is the ELA or reading test. The left side is the math test. Blue is grade 4, and red is grade 8 on the state tests. Okay, I'll talk about the bottom two lines in a minute. The reason we only have one grade here in math is because in grade 8 in recent years, highest achieving students are exempt from taking the test, so that would kind of ball things up a bit. But focusing on grade 4, I want to draw your attention to two things. One is a huge drop in 2009, and then again another drop in between 2011 and 2013 on the state tests. Okay, and that's true in both ELA and math, that big drop there. Okay. The bottom two lines are from the National Assessment of Educational Progress, okay, called NAEP. Okay. NAEP has been around for more than 20 years. It is administered across the country to a representative sample of students in grades. It's essentially designed to measure the achievement level by state. Okay, they draw a representative sample from the state, relatively small number of youngsters in each grade, and they test them and they give us the results. New York City is one of about 20 or 25 cities that voluntarily participates. So the people who run NAEP, in addition to drawing the New York State sample, they draw a separate sample in New York City, so we have a representative amount there. And so while you see the state test has this big drop-off, NAEP is actually pretty steady. That line's pretty flat, and if we had this over 20 years, it would be, you know, similarly flat. NAEP, you know, people refer to as the gold standard of assessment. That flat line, I don't know, in my mind, jives more with reality. I don't know what it means when reading proficiency drops that much over a 2-year period. Did the kids get less smart? Did the schools suddenly have a huge crisis? No, it has more to do with how the passing score is set on tests. So I'm going to blaspheme a little bit about passing scores, because I know everyone in this room we always passed all our tests. That's why we're here, right? So passing tests is good, right? But I used to tell my graduate students, you know, the passing score on a test is not set in stone. It didn't come down on the tablets from the mountain, right? It has to be determined by human beings, right? In New York State, the State Education Department, along with their testing contractor, does studies and they make recommendations. The State Education Commission makes recommendations to the Board of Regents, and they decide what the passing score is on a test. There's a lot of science behind this. Okay, developing psychological measurements or achievement tests is very complicated business. But when it comes down to the final moment of deciding the passing score is going to be here, you have to get this number of questions right to be termed proficient in the modern usage. Okay, there's both science and art involved in that. Okay. The state made changes in two periods. Beginning in 2010, the state changed what it meant to be proficient. And I would argue or interpret that process was more science. Okay? They did it based on a study that they had, which from a few years previous, which looked at a group of middle school students and tracked them through the end of high school when they were ready to enter college. And they looked at what students in New York State needed remediation upon entering college. And then they said, what about the students who didn't need remediation? what were their test scores in grades 8 and 7 and 6. And they used that information to set the passing score on the tests. Okay, made a lot of sense. And we had a bit of a drop when they did that. Okay. 2013 was very different. In my mind, it was more art or politics or value laden. Okay. The other thing to notice on this slide here, it's more obvious in the 4th grade. In 2013, the two tests aligned. That was by design. The State Education Department set the passing score on their own tests to produce the same citywide and statewide estimate of proficiency that NAEP was producing. So the two lines converged there, right? And that's what they did. Now NAEP is a good standard. There is a robust debate that I'm not going to get into right now about whether the appropriate score on NAEP to anchor to is level 3, which is what they did, so-called proficient, or level 2. Okay, some people would argue that level 2 would have been a more appropriate benchmarking. But the point is, in 2013, when the scores really dropped down, statewide and citywide, proficiency rates in the 30s, they got what they wanted. That was by design. Okay? So the schools didn't change between 2012 and 2013. The test changed. The passing score changed. And what was upsetting to me about the debate was people were focusing on these low proficiency rates without being honest about what actually had happened here. Okay? So we decided to compare the city to the state because they were both affected by the same change. And you'll see in both of these charts, these go from 2007 through 2015, English language arts on the left, mathematics on the right. The state, New York State is in blue, and New York City is in red. And so you see that New York City largely mirrors the trends of the rest of the state in both subject areas, with one difference. These are just unadjusted scores. These are the scores as they reported them each year. The city has caught up to the state. Okay, a gap back in 2007. Here in 2007, also a gap. The state testing program changed in 2007, so we can't do valid comparisons previous to that. But I've been around a long time, and if we went back 15 or 20 years, there was a huge gap between New York State and the city. And this is the message that we felt was being lost. In raw, unadjusted terms, ever since 2013, it looks to me like the state actually declined more than the city, and the city has rebounded better. So in 2015, they're even. A little bit of a difference in math. But even the state acknowledged that in their reporting of the results, that the city had largely caught up to the state. Unfortunately, we know that test scores for a school or a district or a city are statistically related to socioeconomic differences in the students who attend those schools. So the State Ed Department on their website publishes the results school by school for every school in New York State. We had our analysts look at the results for over 3,500 schools, all of the public schools in New York State. And statistically, they were able to control for the economic disadvantage. That's something that's defined by the state. What percentage of the students in the school are economically disadvantaged? What percent of the students had disabilities? We control for the race of the students and the gender of the students. Our model accounts for 68% of the variation in English ELA proficiency across the schools and 62% in math, so about 2/3. That's considered a strong model. There's also something else to interpret here. If our model could predict 100%, then we all, educators, myself and Ernie and everyone else, should pack up our bags and go home, because that would say schools have no impact. All right? So schools do. You can't predict everything about the outcomes of schools, and that remaining third is kind of what the business is about, right? Trying to figure out how to get more schools to do better than their predicted schools. And these are the results of that study. Here we're looking at what's the average difference in a New York City school versus an average New York State school after we control for the differences in the student population. ELA is in blue, math is in red. The top pair of bars is all New York City public schools, including charter schools. So all publicly funded schools in New York City have a 14-point advantage in ELA and a 15-point advantage in math in terms of their passing rates or proficiency rates compared to the average school in New York State. So the average includes Scarsdale, and it includes Syracuse and Buffalo, right? It's the average of the state. So in this model, schools in New York City are actually doing better than schools in the rest of New York State. We then break it down between DOE schools and charter schools because that's been a big part of the argument. DOE schools alone also show an advantage over New York State. 13 points in ELA and 12 and a half points in math. Yes?
So this is showing the value added after you
Yes.
controlled for
Yes, you have to control
socioeconomic
for differences
factors.
in the student population.
Excuse me, I
Yeah.
don't see the L's as part of,
Actually, they did not show up in the model as being statistically significant. Okay.
Really?
Some of that we're capturing. Some students are exempted from testing and things like that, right? We're probably picking up some of that too when we look at the ethnicity of the students, right? It gets mixed in with other things. Special needs is a much higher predictor of the school's test scores. Okay.
IEP special needs, you're
That's
talking
it.
about.
Yeah, IEP special needs, right. Okay. Charter schools do show a bigger advantage, okay? 18 points in ELA and 30 points in math. That one, calls for a lot of study. I mean, if charter schools are doing something good, it's really coming through in math. Maybe they have something going on there, yes.
So, but there's no correction here for selectivity of parents into charter schools.
I'm going to talk about that a little bit on the next slide, okay?
And the comparison is all schools in New York State, not like upstate charter school or anything, it's just.
All schools in New York City compared to all schools in New York State. Charter schools are not that big of a presence in the rest of New York State. So there are over 200 in New York City. I forget what the number is in the rest of New York State. So selectivity, and also the question, there is this big advantage in charter schools, but even through tremendous growth, there are over 200, they're not yet 10% of the population. They're trending towards that. But still, we have more than 90% of the students in DOE schools. On this question of selectivity, we can't yet account for that statistically, but a few points do need to be made. In truth, in honesty, some of the high-performing DOE schools are selective. We have programs for gifted, we have selective middle schools and such, so that's wrapped up in here as well. Some schools in New York City are in neighborhoods that serve a more affluent population. So we acknowledge that, okay? And really what we're saying here is there's variation in both sectors. But then looking at the charter schools, of the 20 New York City charter schools with ELA proficiency rates above 50%, 12 at the time were part of the Success Academy network, which was the largest network and remains the largest and the most aggressively growing. And the others are also clustered, 4 in the ICON network, and 3 others are part of different networks, and 1 is an independent. So if you took Success out of the equation, you'd probably get very different results, right? They're the highest achieving ones. And Success Academy, we know, has a particular model, without even arguing about attrition rates. They don't accept students in the 3rd grade and beyond, okay? So there's a selectivity built right in to that, okay? And then at the other end, there's been a lot of criticism of the mayor's approach to lowest performing schools. We do acknowledge, of all the schools within within the state with ELA proficiency rates below 10%, 161 are traditional public schools in New York City. But that's not the only place where you find problems. An almost equal amount, 154, are traditional public schools in the rest of the state. So folks can criticize the renewal schools as much as they want, but there's another, the rest of the state has problems too, and folks should be looking at that, I think. And then 7 New York City charters and 7 charters in the rest of the state are also at the lowest levels. So that's what we did here. We think it presents a more nuanced picture. There is some good news within all the gloom and doom. there's a lot more work to be done. Any other questions?
I want to understand the
Yeah.
161 in New York City with
Yeah.
rates below 10%.
Yeah.
What do you attribute that to? Because if the L's were not factored in as part of the control group, right? But you have
The
other
L students are
categories.
they're in the test results, we're just not controlling for them.
And so the 161, if you were to take the control groups,
I think, here's how I interpret the 161. The folks who are responsible for administering the school system need to be focused. It is no secret that there are low-performing schools in New York City, and it's never been a secret that there are some schools that qualitatively are doing a worse job. People have argued about what the response should be. Should we close those schools? Should we intervene? But, as a starting point, those schools should be looked at. Maybe there's explanatory things that we don't see in the data.
are they in a cluster in a certain neighborhood, year after year after decade after decade?
Some of
Yeah,
it,
yeah,
I would
definitely.
say yes. I would say yes.
And
A
In
long
fact,
time ago, I did a report on that.
Yeah.
and I
Has it
thought-
been mapped out?
oh, I don't think anyone's ever mapped it.
Correct.
You did one, you did years ago.
Years ago, I did, yeah,
The-
like in
one-
the early 90s.
One of the issues with the 161, I think as you start to look now, you'll find that many of the renewal schools are in there, many of the
Yeah.
consolidated schools that are being consolidated or in there or merged as they, nobody wants to say merged.
Transformation isn't applied.
Right. And I think one of the things that will happen is that number of a 161 below 10%, when you take that 10% away, there's always going to be someone else falling down there. I don't think there's
So-
something to hold,
yeah.
some platform to hold these up.
Let me say this, the number below 10% is gonna go down because there's always this creep up of scores over the years, right? But Ernie's right, there's always someone at the bottom, all right? If there was no one below 10%, we probably would have said, what percentage of schools are the bottom 20, we just wanted to acknowledge, all we're trying to do here is that there's variation in both sectors. There are very high-performing DOE schools, and there are low-performing ones.
I would love to see us go back to that idea of mapping out where they are, because I think some of what we found before was some of the poorest congressional districts showed those gaps. Areas where there were large numbers of public housing. Now we would probably match with students in temporary housing, would probably show
Yeah.
a lot of numbers that way.
The other thing that we've actually had discussions will be intriguing. Some of the neighborhoods that previously were home are now sources of areas of gentrification. We don't know yet if that's filtering through to the schools, but a lot of our analysts are eager to
Anecdotally,
get
it
on
is.
that, so.
Anecdotally, it is.
Any other questions or comments before we
Well done.
get to Aaron?
My only comment, I guess, it seems like there could be some explanations that are not about the school performance, but relate to extreme distress of the kids in some of those schools, extreme economic distress. So, just like to point out that things other than the school itself are accounting for this.
Yes.
I think that's an interesting point that you bring up, because some of the things that we've looked at, we talked about how to find these schools and how to support. One of the things we've looked at, the social emotional needs of students and the attempt to really get more of the social workers and guidance counselors and students into the schools to support these students. That's why community schools became a big thing, and the jury's still on how well they really do the work that they're supposed to be doing. But CBOs have become an integral part of the school system all of a sudden. That's supposed to provide that social emotional link that we need.
Thank you, Ray, and we're going to go on and get in most of Aaron's presentation on health and hospitals.
And we'll do the usual, end at 10, and then
Yes.
if there are more questions.
So to give you a little bit of whiplash and to move all the way over the other side of the spectrum, I'm going to talk about health and hospitals, rebranded HHC as they call it now. So health and hospitals has long been an area of kind of fiscal concern for the city. People are always worried about its finances in a kind of way that people are worried, but it always kind of pulls through. I think this year is particularly important to be looking at because I think that there are changes in federal policy as well as state policy that have to do with Obamacare and the ACA, as well as some of the state's Medicaid programs that really are going to impact HHC in a negative way, or their fiscal reality in a negative way. So I think it's an important time to be looking at them. So I'm going to, in this presentation, in the first half, talk about the financial relationship between health and hospitals in the city, how that's been for the past few decades, and then I'm going to move on to looking at the challenges that HHC is facing right now, health and hospitals is facing right now, and what they're trying to do to address those, this transformation plan that's been in the news a little bit. So again, health and hospitals is both a public hospital system and a public benefit corporation. So it's has many hospitals and clinics throughout the city. It provides healthcare to the public like any other hospital or clinic, but it also holds contracts with the city to provide healthcare in a number of different ways, including mental health care and some of those specific programs, as well as healthcare on Rikers and healthcare in some public schools and their clinics. So again, Health and Hospitals is a public benefit corporation, so its budget is not a part of the city's budget. Health and Hospitals budget is about $8 billion. The city's budget is over $80 billion. And those are separate. The city budgets its payments that it makes to health and hospitals, but health and hospitals' entire budget is not a part of the city budget, which is important to kind of keep in mind. So again, what is this financial relationship between health and hospitals and the city? So health and hospitals gets payments from the city, both that it reimburses as well as payments that it doesn't reimburse. Those payments that it does typically reimburse are its debt service that the city pays up front, as well as medical malpractice and some of its employee health insurance costs. Those are costs that the city pays because it can get a better rate than health and hospitals, and then health and hospitals has typically paid them back, but not always. Sometimes they'll forgive those payments if needed, as we will see in the current year. Health and hospitals also get some direct subsidies from the city, which you see on the right side of this, including this kind of unrestricted subsidy that's just extra cash, which sometimes doesn't exist. Sometimes it's up to, in 2015, it was about $100 million. It's a lot higher in this current year, as I'll explain in a minute. Health and hospitals also, of course, gets payments for the cities for specific services like correctional health, like mental health services. The city also pays for some of the collective bargaining agreements through health and hospitals, and the biggest piece of the city's subsidy to health and hospitals is through supplemental Medicaid. So I'll take a step back to kind of explain what that is, because it's a little convoluted, and I won't get too much into it, but the biggest source of funds from the city to health and hospitals is in supplemental Medicaid. So the Medicaid program is the public health insurance program that is run by states, funded by the federal, state, and local governments for people who have low incomes and certain disabilities. It's different from Medicare, which is run by the federal government. It's for people who are over 65. So the Medicaid program, it pays providers to provide health care to the people that are enrolled in it, and those rates are typically lower than that of Medicare or private insurers. And so facilities that see a lot of Medicaid and uninsured patients typically aren't doing well financially. You have Health and Hospitals as a safety net hospital. It sees all patients regardless of their ability to pay, et cetera. And so its margins are very tight. And so the state can choose to pay those facilities that see high rates of Medicaid and uninsured patients extra funds. So that's what we call supplemental Medicaid. If you've heard the actual terms are DSH and UPL usually, but I won't kind of get into those too much. The point of this is to say that the city has opted to move most of its funding to HHC through supplemental Medicaid because it means that it gets a federal match for those payments. And so back in 2003, the city's annual supplemental Medicaid payments to health and hospitals were about $65 million. Last year, they were over $1 billion. So it's gone up dramatically in the past decade or so. And the big financial crisis that HHC is facing is that those federal matching payments for that city's over $1 billion are going down, both because of some of the Affordable Care Act policies, as well as because of state policies and the shift towards managed care. Anyway, so again, this is kind of a graphical representation of the net city payments to health and hospitals going back from 2000 up to the present, and then in dotted lines you have kind of what's budgeted in the out years. And so the top line is the city's payments to health and hospitals, the bottom line are the reimbursement payments, and the black line is the net difference. And so you can see back in 2010 and again this year, the city's forgiven those payments. So that goes down, obviously increases the net payment in those years. And this, as I said, is very much driven by that increase in supplemental Medicaid, as well as increases in the amount of payments that the city gives to health and hospitals for services, as it contracts more and more of its healthcare with health and hospitals. So anyway, this is kind of what's been going on over the past decade or so. And then this is kind of coming to a head in 2016, where we have these impending changes, as well as this ongoing trend of HHC kind of being in financial turmoil, that we've needed to, or the city has needed to, give health and hospitals a lot of extra funding in this current year. And so on this chart, you see on the top line, it says adopted 2016. That's where we were a year ago when the city adopted its budget, how much its subsidy was planned to be to health and hospitals. And then in this middle bar, you have what's changed over the past year. So the city has done these three big things that have increased their subsidy. So in this bottom line, we have where we are at this current adopted budget. And you can see over the past year, the city's increased its annual subsidy in 2016 by about $600 million, largely by forgiving those payments, as well as by increasing its cash subsidy and increasing the amount of collective bargaining money that it's giving to health and hospitals.
So these are, it says that it's in thousands, but these are in millions, right?
Am I wrong? It's thousands in that's like 1.8 billion on the top line. Am I wrong?
So it's in millions.
Yeah.
Right, okay.
Yeah, sorry. So we went from 1.8 billion to about 2.4 billion in this current year. So again, that forgiveness is greatest in 2016, and it decreases in the out years. So you see the city has room to forgive more payments in the out years. It also has room to increase that cash subsidy in the out years if needed. And so the city's done a lot in this current year, a little bit in the future years, and could opt to give more money to health and hospitals in the future. But overall, you're just seeing this massive influx of money to health and hospitals from the city, which is pretty notable. So despite all of those things, despite those changes, despite the increased supplemental Medicaid from the city, the forgive payments, despite all of that, we're still seeing a huge deficit that health and hospitals is facing because of this decline largely in federal supplemental Medicaid funds. And so you can see right now, they're kind of in line. They were doing okay. By 2020, you're expecting this gap of about $1.8 billion. So again, their budget is around $8 billion. That's almost a quarter of their budget that's up in the air by 2020 if no actions were taken and they kind of went through as they are right now. So the city and health and hospitals together have made this plan to both increase their revenue, decrease their expenses, and come into line by 2020. And so I'll spend a few minutes talking about this plan and how it relates to the financial difficulties that health and hospitals is facing right now as well as in the past. So on the top here, you're seeing that, again, as I said, over 5 years, health and hospitals is facing a $6 billion deficit. This deficit is because of, firstly, low patient revenue to begin with. They have a high amount of uninsured and Medicaid patients, so their revenue is always very, very, it's not very high. Again, you have these declining non-patient revenue, declining supplemental Medicaid, and then you have these persistently high expenses by health and hospitals. Their costs are not any lower than that of any other hospital and are arguably higher in some regards than other hospitals for a number of reasons that I could or could not get into. So you have these three big factors that are driving this deficit, and so they've created this quote-unquote transformation plan along with the city to address all of those factors. Firstly, to increase their patient revenue, to address this declining non-patient revenue, essentially trying to recapture all of that supplemental Medicaid through different waiver programs, and then to decrease those high expenses. So I'll get into kind of each of those three areas and both where health and hospitals has been and then where they're trying to go. So firstly, on this side of low patient revenue, this is just a little graphic that we put out a few months ago explaining what the Affordable Care Act did to health and hospitals. And so in this chart, you can see On the left side, you have before the ACA or the Affordable Care Act, Obamacare. On the right side, you have after the Affordable Care Act. So in the blue, you're seeing the share of New York City adults without health insurance. So that was at about 21%. It's gone down to about 14%. It's actually gone down even further since then, but the comparison stands regardless. Before the ACA, you can see that the share of health and hospitals patients that are uninsured, is significantly higher than that of the city, and that persists even after the ACA. And so that decline was smaller for health and hospitals patients than it was for the city's population at large. In fact, the decline in uninsured people in New York City declined by about twice as much as the decline in the uninsured patients that health and hospitals sees. Yeah.
So did they see a decrease in volume? Did folks who suddenly had insurance go someplace else once they had insurance?
There's some of that, yeah, for sure. So one of many things that the Affordable Care Act did is that it allowed more of the people with Medicaid to go to other places. So they're seeing a decline in not a huge decline, but a tiny decline in the amount of Medicaid patients that they're seeing. And then they're seeing a lot of their private insured patients go to other places as well because they now have better insurance and other places will take them. Medicaid patients are also more attractive to other facilities now than they were in the past. So you're not really seeing that big drop in uninsured that you would expect. Anyway, so the point of this is to say is that even now, health and hospitals is seeing a lot of uninsured and a lot of Medicaid patients. And so what they're trying to do is not necessarily decrease the amount of uninsured patients that they're seeing or decrease the amount of Medicaid patients they're seeing. They're just trying to get more money to provide care for those people. And so they're trying to implement these different waiver programs with the state so that they can get higher Medicaid rates for those patients as well as get funding to provide care for the uninsured. This is the beginning of a kind of theme of the whole plan in which what health and hospitals in the city are trying to do is very dependent on these waiver programs that require state and federal approval. Overall, the entire plan is about half of this $6 billion that they're trying to recapture is dependent on state and federal approval. About half of that they've already gotten approval for, but that also...
What type of waivers are they trying to...
They're mostly Medicaid waivers, so they have to be approved by both the state and by CMS.
Be able to do what? That's what I'm saying.
There's a variety of them. One of them, there's like their designation as a federally qualified health center, which lets them get higher rates reimbursement rates at their clinics. There's the district program is a big part of it, which some of that has been approved, but they're also trying to convert a lot of the DISH and UPL money into another district type waiver, and so to kind of funnel that money through district. And then there also is a separate waiver or an addendum to one of their waivers, I should say, that would allow them to get funding for care for the uninsured, similar to something that California is doing. Anyway, so that's how they're trying to address the patient revenue piece of this. So again, this declining supplemental Medicaid, as I just alluded to, this is their revenue forecast over the next 5 years. You can see how the patient revenue is pretty flat. Other sources are also pretty flat, but that supplemental Medicaid is what's driving that to go down. And they do have all of these waivers that they're trying to put into place to recapture those funds. As an aside, they're also trying to increase their other types or increase their revenue from other non-patient revenue sources, i.e. to increase enrollment in MetroPlus, which is their health insurance company. And so if they're able to get more people enrolled in that, they can not only reap the funds from doing that, they can also get more patients into their facilities, hopefully. Lastly, you see how their costs are trending upwards. So this is looking in the last 5 years. You've seen inpatient admissions go down. So on the left side or on the right side, you're seeing visits, and those visits have gone down by about 15% in the last 5 years. And the receipts from patients have stayed pretty flat in the middle there. That's the green line. But the costs of staffing all of those facilities have gone up over that time period. And so one of the big things that Health and Hospitals is trying to do is to rein in those costs. You've seen, this is something they've been doing over the last year to reduce staff through attrition, not necessarily through layoffs. That's one of the things. And then they're also just trying to reduce other costs that are not necessarily staffing costs. in the future. So those are kind of the definite ways that they're trying to reduce costs, and those have been in play for about the past year and are, they've been able to effectively put into place. The kind of larger part of their cost reduction plan is to become a more outpatient-focused center. And so Health and Hospitals has hospitals as well as clinics. And it's a lot cheaper to run a clinic than it is to run a hospital. And so they've committed to not closing any hospitals, but they,
Just
yes.
a question.
Yeah.
Why, they have a lot of unused space, very large buildings, very empty, lots of empty beds,
Yeah.
and that's totally political? You figure that they'll eat that course?
Yeah. What I think is, I think it's political that they will not close a hospital. What I do think is going to happen is that they're going to downsize hospitals and potentially turn a hospital into a clinic. So a place like NCV or North Central Bronx, which is their least used, emptiest hospital by far, I think there's a good chance that could become just a very, a very good clinic with a lot of services.
So in other words, a Metro Plus clinic.
Yeah. So they have these 6 diagnostic and treatment centers, like Gouverneur, and so I think they might kind of shift some of their hospitals into, they could keep some of the beds, but just to keep them very low bed and high outpatient focused centers. And similar into what they have done with Beth, or what Sinai is trying to do with Beth Israel. Tripping over my words, sorry. And I think they were very excited to see that when Mount Sinai announced that they were going to do that to Beth Israel, it got a fairly okay press. No one was really, outcried as they were maybe 5 or 10 years ago when a system would say that they were downsizing hospitals. I think people are becoming more and more okay with that idea that we don't necessarily need all of these beds and all these hospitals, that we can move towards a more outpatient focused system.
So is there a corresponding increase in outpatient visits, or
In
they're
this-
just
they're-
losing those?
Yeah, outpatient's pretty flat. It hasn't really changed too much, but inpatient has definitely declined. You would think that there would be more of a corresponding increase in outpatient, but we haven't really seen that, potentially because they are losing patients.
And these inpatient visits are not measured in days, it's a
Yeah,
patient.
these are, there are measures that are in days, but this is in just visits.
Right, but I assume that the days are shrinking also, so you're saying that
Yeah.
usage.
Yeah, everywhere but Bellevue, but because
So
it's.
just to be clear, your inpatient visit is your admitted patient.
Yes. Admitted patients.
As opposed to outpatient, which you have not seen an increase in.
No, you haven't seen an
Overall.
increase in outpatient. You've just seen a flat amount of outpatient. I didn't put it, I should have. I didn't put it on here really because then you'd need a third access.
Right. And I don't know if your report has determined whether or not there's a correlation between more access to medical clinics
Mhm.
as attributing to what would be no increase in outpatient visits to our HHC network.
Say that, sorry, I'm,
So take for instance Woodhall
yep,
is an HHC and connected to NYU, right?
Yeah.
And so, and Bellevue, right? So, Woodhall has a lot of outpatient.
Woodhull does do it, that does by far
Very
the
well.
greatest amount of
Correct.
outpatient,
And
yeah.
so their opportunities to see more preventive measure as
Mhm.
opposed to admitted patients, I would tend to recognize that perhaps their less inpatient is due to preventive and more clinical based outpatient services.
Mhm.
But we also have seen an increase in more options in the neighborhood.
Yeah.
As far as medical facilities are concerned.
There's urgent care facilities, there's, yeah,
Urgent care
Correct.
and all that, yeah.
yeah.
So I don't know if you studied that in this report.
I think every hospital is different. There are hospitals that have always done a fair amount of outpatient and have always done less inpatient. You can see across all hospitals there's a trend downwards in inpatient. I think that is true of every hospital in New York City.
But the same is true where you see more urgent care facilities
More
being
urgent
open
care,
in
yeah.
every other block in certain neighborhoods.
Yeah, and so I've seen, there are some hospitals that have seen an increase in outpatient. For the most part, it's fairly flat. And I'm sure that's not true of every hospital. Again, when you're talking about health and hospitals, it is difficult because it's 11 different hospitals. It's, 3 dozen clinics. And so I'm looking at kind of the aggregate numbers, and there are variation between all these sites.
Are you looking at all and how Metro Plus is not able to attract the people that they thought they would be able to do?
Yeah, I mean they've downsized what they thought they were going to be able to do. They're right now they're a little under 500,000 enrollees enrolled in Metro Plus, and that's gone up by maybe 50 or 60,000 in the last few years, so not a ton. Their goal a year ago was to hit 1 million enrollees by 2020. They've downed that to about 600,000. And so their current budget, in which they would become aligned in the next 5 years, is only dependent on them achieving another 150,000 or so enrollees.
And most of those are either employees of HHC or
City, well, they also have the city employees as
some
well.
city employees.
Yeah, and I think a big part of it too is this basic health plan, which is a low income or a private plan that is not a Medicaid plan. That is trying. The premiums are very low, so I think they're trying to attract people through that as well. I don't think anyone can really say why they've had so much trouble enrolling people. There is some extent to which, now that Health Republic is gone, maybe they'll be able to capture some of those people, but I don't have a good explanation for it.
One other question about the inpatient visit. So somebody goes to the ER and gets treated, but does not get admitted to the hospital. Does that count
This
there?
is not looking at ED visits. ED visits have gone down though. Not by a lot, but they have. Sorry.
How
Yes.
many slides do you have left?
Just to wrap up, really this is all to say that this plan that the city and Health and Hospitals has put together is dependent not only on the approval from state and federal waivers that I kind of got into, which is about half of the achieved financial savings. Also, they need to get cooperation from their unions, including DC 37, Doctors Council, NISNA, which is the nurses union. They need agreement from all of those as they do shift to a more outpatient sense of care, and they also need to successfully do this transition to more outpatient focused care. Yeah, thank you.
Thank you.
Can I make one comment? First of all, thank you, and that was really good sprinting. We're having difficulty finding a dean or former dean of a graduate school of business in the city of New York. Nancy Waxstein was interested in the new dean at Fordham. But apparently she's so new that she felt she didn't have time to do this. We sent out a note with three others. Here, you've been doing this, Lisa. So 3 others that we know nothing about.
So if you have any information or any other possible candidates in mind, please let me know or let Nancy know, let us both know.
We need a
and
dean.
thoughts on the bios. That would be helpful.
Yeah, I mean, even if you just read the 3 bios and say, look, if Nancy's gonna be making cold calls to people, who looks most promising? It's come to that. Thank you.
Okay, so with that, it's 10 o'clock. We're ready to adjourn. We don't have a quorum. Do I need
Oh,
to?
right, we don't need to, we're not in an official meeting.
So we can adjourn, and then anybody who wants to 2 o'clock can talk.
Yeah, no, absolutely. If anyone wants to stick around, talk more about health or about anything else, please join us. Thank you.
Thank you, Lauren.
Great, thank you.